And here is your question. Okay, so if you have read and understood, considering it communication skills station, kindly please begin.
Okay. Hello, I'm Dr. Aya, the SHO working in this hospital. I want to speak to the Mr. Mann, the hepatobiliary consultant, to take his advice about the patient. Can I check whom I'm talking to?
Yes, I'm Mr. Mann.
Hello, Mr. Mann. I have here a 44-year-old female.
Who is the consultant of this case? Who is the consultant of this case?
The consultant of this case?
Yes.
Mr. John.
Why you didn't inform him?
Because I need I consulted him first. We need the hepatobiliary surgeon consultant opinion.
Okay, summarize your case.
I have here a post-operative day 4, 44-year-old female patient. After going to a cholecystectomy, she had an abdominal pain, worsening abdominal pain. On ultrasound, there was a free fluid, and the lab shows WBCs of 18 and CRB was raised. Also, bilirubin was raised. So we are suspecting bile leakage. And I'm calling you to transfer the patient to your ward.
Okay, what do you think the cause of this bile leakage?
For the recent surgery, it might be slip clips or retained CBD stone. It could be a CBD injury or a leakage from the liver bed.
Okay, this case is urgent.
Actually, yes, it's urgent because it could lead to peritonitis, biliary peritonitis.
Yes, so tell me how will you manage this case?
First of all, after consult, I will go according to the care of critically ill patient. I will give resuscitation, IV fluids, and antibiotics. I will take a set of blood. And after that, the definite management would be an ERCP and stenting, maybe.
Okay, what if there is a missed stone? How would you manage?
I couldn't hear you. What?
If the cause was a missed stone in CBD, how you manage this situation?
Yeah, it's the same. And by the same way, but using RCB also to get out of the system.
Okay, there is anything can you do before ERCP to confirm that is a missed stone?
Ultrasound.
What else?
RCB.
Yes. Do you need any arrangement with anyone before you transfer the patient?
Yes, I would arrange with the bed manager of both hospitals to decide with him creating a bed for me, maybe facilitating discharge or reprioritizing other patients.
Okay. Okay, you can transfer the patient.
It's already 4 minutes are left. Okay, can you please tell me why the CRP is high? Do you think patient is having infection?
Actually, CRP might be high because of the surgery and because of acute inflammation.
Okay. When these blood tests were taken?
Unfortunately, it was 2 days back, but as soon as I will finish this call, I will send the new bloods.
Have you done ultrasound? What does it show?
Yes, ultrasound showed a free fluid in the abdomen.
Bile leakage. Okay.
Yes.
Tell me, what is ERCP and how is it carried out?
ERCP is a short of endoscopic retrograde cholangiopancreatography. It's an X-ray examination for the
Yes.
common bile duct. It's like a flexible telescope. It goes through the esophagus, and once it gets to the ampulla vator, we put the dye to show the pancreatic duct, the gallbladder, and the hepatic ducts.
Okay. What are the purposes of doing ERCP?
To see the what's the question?
Yes. What's the purpose of doing ERCP?
Yes,
Still,
to
it's
check for the bile
diagnostic
leak.
and therapeutic. Yes.
Yes, if there's bile leak, there will be extravasation of the dye to the abdomen.
Okay. And so it's
And of course,
diagnostic.
therapeutic
You
for
told me.
stenting.
Yes.
Therapeutic
So
for stenting.
therapeutic
Yes.
stenting. So this you have
Yeah.
to tell me. Is there drain in situ? Does the patient has a drain?
Yes.
Yes. Did you say yes?
No, they will check.
So you say you're not sure, you'll check and you'll get back to the consultant and you'll tell. Okay. When do you think drain should be removed?
Once it's the draining less than 400 ml. 400 ml. 400.
If less than 200 ml per day. Okay. Right. You told me what are the sources of bile leakage, right?
Yes.
Would you be all right? What is biliary peritonitis? How would you define it?
It's a peritoneal inflammation caused by leakage of the bile through the peritoneal cavity.
Yes.
It can be caused by gallbladder perforation or trauma to the biliary tree or a spontaneous perforation
Okay.
of extrahepatic bile duct, or also peptic ulcer can cause it.
All right. Can you tell me if there are no beds available in the hospital, what would you do? How would you go ahead?
Okay. I will alert the bed manager about the urgency of the transfer of our case.
Okay.
And I will ask him if he can find a bed for me by discharging patient or repartition of the patient.
All right. Okay. Right. Then you can send the patient, transfer the patient. Okay. Few seconds are left, but then here you can ask the consultant that how do you want me to manage the patient, or they can ask you while you're waiting for the patient to be transferred, how would you manage the patient? What exactly would you do?
I will give him a
Well,
fluid resuscitation,
yes,
check the vital signs regularly.
yes,
I will and give the patient also antibiotics.
according to NHS guidelines. Okay.
Yes, according to after discussion with my microbiologist.
All right.
Until he gets transferred to the hospital.
All right. Good. Thank you.